Hi there, I'm Dr. Jennifer Stiff, board-certified pediatrician, and welcome to Norton Children's Little Talk with the Doc. Today we're going to talk about fever in kids, how to measure your child's temperature, what's considered too high, and when to seek help. First, let's talk about what a fever is. A fever is a temporary increase in body temperature, often due to an infection or illness. For most children, a temperature at or above 100.4 degrees Fahrenheit or 38 degrees Celsius is considered a fever. When it comes to taking your child's temperature, there are several methods you can use. Digital thermometers are versatile and can be used in the mouth, under the arm, or in the bottom. Rectal measurements are typically the most accurate for children under 3 years old. We know rectal temperatures can be scary, so let's walk through it. First, make sure the thermometer is clean. You can use a little lubricant like petroleum jelly on the tip to make it easier. Gently insert the thermometer about ½ an inch into the rectum. Keep it steady and hold it in place until the reading appears. Have another grown-up help if you feel it's necessary. When you're done, clean the thermometer with soap and water to keep it safe and ready for next time. The under-the-arm method is less accurate than other options, but can be a quick way to get an estimate of your child's temperature. If you're using it under your arm, hold it snugly against the skin and lower your child's arm down. Keep it nice and tight, but not uncomfortable for a good reading. Finally, the mouth method is probably what you may be used to. Place the thermometer under the tongue and have your child close their mouth around it until the reading appears. Make sure they haven't eaten anything hot or cold before the reading as to not alter the result. Ear thermometers can provide quick readings, but make sure the ear canal is clear and dry for accurate results. Now, let's talk about when a fever is a concern. Generally, a fever in a child is not something to panic about and can be helpful in fighting infections. But there are important guidelines to follow. In babies under 3 months old, any fever of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher should be evaluated by a doctor immediately, as their immune systems are delicate. In children from 3 to 6 months, if their fever reaches 102 degrees Fahrenheit or 38.9 degrees Celsius or higher, and especially if it lasts more than a day, it's wise to contact your pediatrician. If your child's fever lasts more than 3 days or is consistently high, above 104 degrees Fahrenheit or 40 degrees Celsius, seek medical attention. If the fever is accompanied by severe symptoms such as trouble breathing, a rash, constant vomiting, or unusual drowsiness, get in touch with your child's healthcare provider right away. Remember, fevers often are a sign that the body is fighting an infection. Keep your child comfortable, ensure they stay hydrated, and monitor their temperature. When in doubt, don't hesitate to consult your pediatrician. For children over 3 months, we always recommend to look at the child and not the number. If your child is acting fine, it's okay to write out the fever and try to keep your child comfortable. For more information about fevers, visit nortonchildrens.com. If your child needs treatment from a pediatrician, visit nortonchildrens.com/pediatricians to view all of your pediatric care options. For more Just for Kids health tips from trusted pediatric providers, don't forget to subscribe to our YouTube channel.